Good morning, good day, good morning, namaskar. Engineer Suraj Singh speaking from Bharat, India in relation to pertinent COVID-19 strain, COVID-19 strain and variant issue, usual talk probably every day. We cannot improve ourselves because we are sleeping a lot. Nation and people of this country are sleeping a lot. Unfortunately, I have to say this in starting this day of January 5th, 2020. I'm talking about status of January 4th, 2021. I'm sorry, 2021 again. It was the status of January 5th, January 4th, 2021, reported on January 5th, 2021. Title being Bharat, India, an analytical informative talk on COVID-19 plus variant strain status for January 4th, 2021, reported on January 5th, 2021. Government of India provided data-based workout spreadsheet file screen share for national awareness for Government of India has been sleeping. Unfortunately, I have to say this. Our government is sleeping and our people are sleeping, and this file which you are viewing is competent file based on nearly complete projection and information that we get from government website every day. And before going further, I would like to talk about yesterday's status, and that is here. You can say they always claim that government of India always claims that India is taking all necessary steps to ensure that we are prepared well to face challenge and threat posed by growing pandemic of COVID-19 coronavirus. With active support of people of India, Bharat, we have been able to contain spread of virus in our country. Most important factor in preventing spread of virus locally is to to empower citizens with right information, taking precautions per advisories being issued by Ministry of Health and Welfare. This claim is made by government every day, and you can see this graph. This is graph of death, and this graph, this is graph of death here, and you can say I'll put another graph. I think I missed that one, no problem. I'll put that one as well. That is here, you can see here, and you can say it's another graph here, and it's that one, and we can say okay, we will select data on sheet 5, and this is that sheet 5 it is, and this is that graph. So let us say this is death in crores, this graph. Now we go to our initial work. I was talking of here, I used another sheet on this because other sheet is too heavy. So this is state-wise data, Bharat, India, COVID-19 plus. This is, I put it on 5th, that is on 4th. Okay. Let us see previous data. What is that? Sheet 3, sheet 4, sheet 3, and that is other one, and we will see that. You can see that. Okay, sheet 5 it is now. Sheet 5 and sheet 3, we compare this 1947, and this should be, so it is different. Okay, fine. So daily cases are Maharashtra Maharashtra 19.47011 lakhs, Karnataka 9.22538 lakhs, Andhra Pradesh 8.83210 lakhs, Tamil Nadu 8.21550 lakhs, Kerala 7.78873 lakhs, Delhi 6.27256 lakhs, Uttar Pradesh 5.88882 lakhs, West Bengal 5.55572 lakhs, Odisha 3.30492 lakhs, Rajasthan 3.10278 lakhs, Telangana 2.87993 lakhs, Chhattisgarh 2.83515 lakhs, Haryana 2.63312 lakhs, and Bihar 2.53272 lakhs, and Gujarat 2.47926 lakhs, Madhya Pradesh 2.4467 lakhs, Assam 2.16340 lakhs, Punjab 1.67441 lakhs, Jammu and Kashmir 1.21786 lakhs, Jharkhand 1.15689 lakhs, Uttarakhand 92,112, Himachal Pradesh 55,808, Goa 5,133, Pondicherry 3825, Tripura 332, and Manipur 2833, Chandigarh 1993, Arunachal Pradesh 167, Meghalaya 1348, Nagaland 119, Ladakh 95, Sikkim 59, Andaman Nicobar 4, Mizoram 423, Dadar Nagar Haveli 3, and Lakshadweep 0. This is tally. This is, you can say, total cases that were updated yesterday. These are total cases, not individual day cases, and these are active cases, total active cases, and these are discharge cases. So here are deaths. So percentage is here, this is death percent. All these three percentages, you can see these three columns. As every day we say, here you can say 2.08 is active cases percentages, 93.94 is percentage for those who have left isolation rooms or discharged, you can say, or they have come out of their private, you can say, isolation rooms, or discharged from hospitals or government hospitals, private hospitals, whatsoever. And 1.2 is percentage of those who have lost their lives, and sum of these two is 3.28%. This is that, but we are concerned with this problem here about whole population actions, what we are taking. We do not expect government of India to do it because they are not doing it. We expected that, but they are not doing. And target milestones, where they are, what they are, we do not know, and cannot be fixed. You can say, cannot be fixed due date. You can say, what you call it. You can say, we cannot fix these milestones or target milestones, you can call them, because we don't have reliable information to compose or to design or to project those milestones. Control schedule is last item that we can say how to win over some problem, how to defeat some problem, and that control schedule cannot be drawn because of these informations are not given, and we cannot chart out that come what may. We can't chart that, and we have not to forget that this problem is going to work up to 2024 and come down to 25 to 2029 according to understanding by many scientists, a statement made by many scientists at all levels from various countries, and also what we think is right here. What we expect that according to the current situation of COVID-19 variant and strain, what's happening is unclear. So we cannot say comfortably, or we cannot say with concrete evidence, but expectations are there, and longevity of this COVID-19 stay on earth is this one which we expect is going to stay from 2020 to 2029, because itself started in 19, so 19 goes to 29, a decade program. Well, our purpose is different. Here we can say we have to project probabilities, and these probabilities have been drawn from various you can say this given data. You can say they themselves also, government themselves is saying that up to here is government data, you can say, and this is average which we worked out from here. So this is based on government data, and these projections have been extrapolated because of this data and due to this data. So it says 1.2%, so that's so far, and this means if you go to sheet 1, you will find so far only 17 crore 65 lakhs people have been tested, which is 13.579% of total, and 86.421% have no been tested. So this is dependent on the 765 crore, 7.765 crore people. But our requirement is different. We know whole population is 130, so we say 1.2% people have lost their lives. This was very easy to say that this is for only 13 point something. So we can say 13, I guess. So what about others? Means we have to take whole population into our consideration. So it is 1.56. You can say when I multiply this with 130 crore, I find 1.56 crore must have lost their life rather than what they are saying. So 1.2% is 1.56 crore, but they are saying differently. They are saying only 149,850 or 1,49,850 people have lost their life, which is not true. Which is only 13.579% true, you can say. Only 13.579% true, 86.421 excluded there. So we include here in this calculation, so it's 1.56 crores probably. There's no indication, but this is statistical calculation, analytical calculation. Then we have to take into consideration time gap, time interval, you can say. We can't take every day or every month. We are thinking, okay, just take a period of quarter, years or 3 months. So this is 3 months, this is 3 months, and all these are 3 months, you can say. So covering 2 years, so 4th, 7th, 10th, 13th, 16th, 19th, 20th. First we have taken 4 months because let's give some gap, some concession to them. So what we have to do, we have to consider population hazard. What is population hazard? This is what we are talking, this population hazard. What is required? Conduct more tests, and what's further required is conduct tests rapidly. That's what I'm saying. So we can say we give a gap of 25% of a year, means 0.25 coefficient. We're giving here 1.25. So which makes 1.2 to 1.50%, then it goes to 1.88%. In the same way, and goes to 3.35%, and goes to 2.9%, and further goes to 3.67%, and then goes to 4.58%, and then further jumps on to 5.73%, and then it moves to 7.1% at end of 2 years period. This means if you take in same proportion, as I said, 1.2% gives 1.56, 1.5% gives 1.93 crore, 1.8% gives 2.44 crore, 2.35% gives 3.05 crore, 2.93 gives 3.81 crore, 3.67% gives 4.77 crores, 4.5% gives 5.96 crores, 5.73 gives 5.7% gives 7.45 crores, and 7.16 is 9.31 crores. And this is based on 130 crore population. This can vary, it's not guaranteed, it's right, but and if you see the graph of this, and this is that projection, and this is our projection, this one, on this basis, and we can say that if we club, because these 2 points are very critical, this is death and this is active cases, we club them, because they were all active one time. This 1.2% was also active one time, so active cases actually were 3.28 here in this case. So if you take this 3.28, you will find different approach here, and you will see this is data here was 5.33 crores to 25.41 crores, and that's where curve changes here, and we get this curve again modified itself. So we can say that it's a big problem here. We should understand this point very, very clearly. So 3.28% I stick, and 3.28 means you know what's there. 3.28 it started is 4.26 cell after a lapse of 2 years with this much, and at end of 10.4 on 1 year. So let's go back to 1.2%, don't confuse otherwise, and let us see what to do with this point. This point depends on what we are actually doing, and we have to go back to sheet 1, and what it says, let's see. First of all, let me tell you again that where is data I'm taking from. These five highlighted columns, you can see these are government data. We are publishing, I collect, there are more data, but I'm taking only this data. It is total test update, and this is daily test conducted, and this is infection update in numbers. That's update 1, this is also update 1, this is daily test conducted, this is daily update, and this positive update to it, and is death update. That's what they are. Others we are calculating also. We calculate also. All we did was just put serial number here, and report day here, with the population here. So these are very ordinary 3 columns. Don't worry about them. This is a percentage of total. Whatever we tested, and how many population is there, how much population there, how much percent is that one, that's this one, and you can say it is 0.0769% tests were conducted yesterday, and this is here you can say how it is, we can say total test update, and this is sort of like yesterday it was, the update was 17.65 crores, 17 crores 65 lakhs 31,997, 17 करोड़ 65,31,997 अब तक के टेस्ट हुए हैं. A percent 13.579% बनता है, is 13.579% because this percentage of total percentage total tests done of population. So this is, you can say 13.579 it is, and balance is 86.421, about whom we do not know because there is no policy at all. So we cannot say they shall be tested or they shall not be tested because they have not been tested. Only 13.579% population of 17.64 have been tested. Based on this data exists. 86.421, or which is equivalent to 112.34 crores, 112.346 crores. These people's testing status is unknown. We don't know what shall happen to them. I can't answer. And if you take into consideration this point that every day how many we are testing on average basis, this number 5.67627 lakhs based on average, and you can see formula F112, which is here F112. This is figure, the updated one. I divide this figure by C113, and that's 311 days. So in 311 days, we could be able to successfully tested. We could successfully test once 17.65 crores. So in one day average, we can say in we consider 311, which is up to today. It is the 5th of January, starting from March, April, May, June, July, August, September, October, November, December, January. So up to 311 counting is done, and this we divided by this one, we got this 5.67627. Actually, if you measure from 311 days, it's result. Now we go again further. We say that okay, fine. This is your this is your column which gives you 896236. Yesterday, the tests conducted were for people amounting to 8.96236 lakhs. 8.9623 lakhs, 8,96,236. कौन नहा रही हैं? जाके पूछो नहा रही हैं. 8.96236, 8,96,236 के टेस्ट कल हुए, और ये थोड़ा बड़ा है परसों वाले से, पर गिरा है. अगर आप ये लें यहाँ पे 8107, इससे 1 2 3 4 5 6 days, if you take 6 days gap, you'll find that how many drop is there? 107 is this, then minus 112, and divided by 112. If you divide by 112, we get 112. You get drop here, which is 26% in this period. You can say almost a week. There's a drop of 26%, which is not acceptable. In fact, though there is a daily variance, but we are taking a 1 week time here, and we can see that we are not doing good. There's no cohesive testing system. It's saying that it seems that it's a cohesive system. So 8,96,236 persons were tested yesterday, which is not according to mark. We should have been 50 lakhs minimum, 60 lakhs, 70 lakhs. So we are much below in testing speed. And this is here, total number of infections done so far, which is 1,356,844. This is infections done so far, and you can say that it is 16,375. They are saying 16,375, 16,375, 16,375 लोग कल पॉजिटिव डिक्लेयर किए गए. दिस 16,375 persons were declared positive yesterday, and this is what they want to tell whole world. And news are coming on different world news that India is down, Bharat is down in positive infections, but nobody is caring about. We are just concealing certain secrets, certain facts. This is I can say identifying number, identifying cell they are using, identifying information they are saying. See, we are down, but this is on based on 13.579 percent people, which is a, you can say, this is a fictitious that I can say, because everybody cannot see all this data all over the world. They don't have this system. Even WHO doesn't have this system. So they accept this is okay, fine, you have done well. But they forget this is based on 13.57. So in this health issue, we should not hide data. There's no competition at all. We should hide data and tell them, yeah, this is question of health. By telling something wrong to them, you are not getting serious. And by telling something illogical, you are even subjecting your nation to health hazard, super health hazard. We should be concerned about this. It's not politics here. There's no achievement here. It's a question of health. And it's very, very serious issue. We should not lie on this. And because we say 16375, it goes to actually this figure. If I'm 112, I say, into D5 or F112, F is here, this is this. So it is actually, if you say correctly, this should 16375 is the wrong, right figure is this. 125.7, when I'm depending on whole population. If you take into consideration whole population, you will find 1,20,587 in this place, because I extrapolated it by calculation, and this comes to 120,587, 1,20,000 so तासी actually possible हुए होंगे, which are not on record or they are not on publishing data. This is unfortunate. So this and this, we have to be very serious about this. Or I can say, if you put here, it doesn't matter, put here, no pair, because this is here fact. Infection data, access in crores. So this is this data. We should be 9 crores at least, if not less. It should be 9 crores minimum, which goes to 35 crores. In fact, this is per data of government, and this is per data of assessment. Government data and real assessed data is this. This is very, very serious, and they say 149,850 people have lost their lives. Okay, fine, we don't dispute on that. That's a recorded figure, though there is more on that. I cannot say anything on this because it is data. And also, if you think this way, that 16,375% were declared, and they say if you compare it to this one, this is total number of tests done. This is total number of tests done, and this number of people infected, declared infected. So you can say, let's see how many percent it is. If you say here, this is M112, which is this one, M112 divided by I112, and I is this one. So that's what I'm saying. Persons that have been declared positive out of persons those have been tested, this is 1.83 here in this day. In this day 1.83. Yesterday it was 2.24. Day before yesterday 18,177, that is 1.9, and before that 2.3. So we are taking these 4 rows, these 4 days at least, just to know what happened. We could take previous also, but okay, let past bury that. And now this 4 days is telling this 2.3%, 1.9%, 2.24%, 1.83%. And average of this is coming 2.07%, and when you apply this to whole population, we got 2.69 crore cases yesterday. In fact, this is fact that average is that of 4 days and 2.69 crore cases of exposure to, or you can say, which might not have been declared, but this 2.69 crore people must have been infected in one day. To be very frank, this is assessment. And this means it's nuclear fission ongoing due to COVID variant and COVID variant, and you can say strain, you know well what I told you before, what is a strain, and we should be very serious about this strain. So before jumping on to further, I have told you there's a drop in cases and 1108 days are there required. I like to first give that I posted and that I should speak. It's very intelligent work, and you should have patience to read that and to listen to that. That's a very important point. And if you can find you got something, we say, we just title is same as we say in this case. Title is same. There's no new title, but we can say An analytical informative talk on COVID-19 plus variant strain status for January 4, 2021, reported on 2 January 5, 2021. Government of India provided data based worked out spreadsheet files screen share for national awareness of government of India has been sleeping. Sorry for this. Excuse me. So, Government of India claims as follows. I read earlier, I again read for your reference. It says that reality is different, but government says as follows, which I quote and quote. I see quote is Government of India is taking all necessary steps. It's written on their website. I'm just reading. Quote is Government of India is taking all necessary steps to ensure that we are prepared well to face challenge, and threat posed by growing pandemic of COVID-19 coronavirus. With active support of people of this country, Bharat, India, we have been able to contain the spread of virus in our country. Most important factor in preventing spread of virus locally is to empower citizens with right information and taking precautions per advisories being issued by Ministry of Health and Family Welfare. Now you can understand what they have done. They are actually, this paragraph is just a silly paragraph because they say we have been able to contain, हमने संभाल लिया है कोविड-19 को. ये पैराग्राफ ये कह रहा है सरकार सारे कदम उठा रही है, जरूरी है, इसकी तैयारी कर रहे हैं हम इसको चैलेंज को संभालने के लिए, और हम पब्लिक के सपोर्ट से सारे काम कर रहे हैं जो होने चाहिए, और हम एजुकेट कर रहे हैं पब्लिक को, और हमारी मिनिस्ट्री बता रही है कि आपको क्या करना चाहिए. अब बताइए, वो कह रहे हैं इससे हमने संभाल लिया है. कौन मान लेगा इस बात को? ये डाटा इनका ही मना कर रहा है, मैं नहीं कह रहा. इनका अपना डाटा, देयर ओन डाटा इज टेलिंग सम अदर स्टोरी एंड दे आर राइटिंग हियर which has nothing to do with factual life and factual status of this. Well, don't worry about this. Let them say anything, whatever they say. They have a right to say something. They want to satisfy people of this country. Satisfaction is not necessary. Health containment is necessary. Well, then there I have posted about 31 URLs of my everyday post, and then there are videos which I'll include today's videos as well as 43, so including totally 44. I say Bharat India COVID-19 strain variant report update 5th January 2024 known, and Bharat public must think very seriously about how to achieve risk loss prevention by application of required pertinent measures in relation to COVID-19 plus exposure, because nothing is being seriously done by our nation. I think आप यह समझ रहे होंगे, इसमें इतने सिंपल इंग्लिश नहीं समझेंगे क्या. बिल्डिंग ऑलवेज, क्योंकि मैं अगर हिंदी में इसको बोलता हूँ तो बहुत टाइम लग जाता है. बेटर यू अंडरस्टैंड दिस एंड यू कैन सी पोस्ट देयर इज अवेलेबल. Building always remains prone to fire, but if loss prevention methods are applied, loss to life property can be minimized. So this also applies to COVID-19 plus, which is also a fire, like a fire. Possible magnitude of risk must be understood or evaluated by analyzing its power, and then, based on analysis, practical applicable solution must be searched and finalized prior to it is too late. COVID-19 strain variant has already spread in many countries such as Bharat, Canada, UK, Australia, European countries, Singapore, Hong Kong, Sweden, Jordan, many more, in Middle East elsewhere. Bharat India has crossed to many days back 1.035 crore COVID-19 and also many cases of variant strain have been reported from various parts of Bharat India. Individuals out of 130 crores population, only 17.653 crores or only 13.579 population tested, and 86.41% population certainly remaining untested. No worry for even COVID-19 strain plus on Government of India or on people of Bharat India, as mostly people of ours have become sheer careless. When I say sheer careless, means high degree of carelessness. It is irresponsible and ignorant. We are also irresponsible and ignorant. You can say no plan is available for remaining 86.421% population who have been remaining untested, which has made it impossible to fix certain required milestones and schedule out prospective time-scale-based plan to combat COVID-19 impacts. It is a must to have a concrete schedule or plan to control COVID-19 plus, just to avoid its powerful explosion that could cost crores lives directly and many crores additionally infected. Testing speed has been non-conducive, extremely unsatisfactory, which means no plan can be charted out at present state of COVID, present state, all right. Real state of future of COVID-19 in Bharat India cannot be correctly either forecast or predicted analytically. In this connection, I had sent email many days past 2020 giving many of above URLs to government, which email acknowledgement was received, but no further response from government of India has been received, and no other planned scheme informed by government of India, and it's not expected anymore either. Never expected the government to be so high degree responsible. Is of so high degree responsible, and no change or accelerating program is visible. No projection of any program is available because there is no program. In fact, testing speed has been still really outstandingly unsatisfactory, whereas government of India has always tried to reflect least number of positive cases by manipulation of data. No reported indications seem to be on part of government of India to an extent testing on the whole population is concerned. And in case of no right reliable data, no projections can be reflected. Government of India does not take any responsibility for testing of common citizens. It is assumed to be responsible as citizen to have a test if one feels that is infected or symptomized by COVID-19 plus. Government of India has distanced itself from owning public health responsibility. Total number of tests conducted up to 4th January 2021 is equal to 17,65,000 17 crore 65 lakhs 31,997. Tests conducted on 4th January 2021 is 8 lakhs 96,236 only. Total corona infections till 4th January 2021 equal to 1 crore 3 lakh 56,844. Positive cases declared on 4th January 2021 to 16,375, which is more than point. They want to show manipulated data by government, I can say. Self-deceiving data it is. That update till 4th January 2021 is 149,850, 1,49,850, 1,49,850. Population tested is 13.579% only since March 2020. Remaining population without test is 86.41%. Time required for whole population testing is 1281 days, and for remaining population 1108 days. This 1108 is this required day period admissible? Whether public has to accept it or public has to reject it is question mark. Public has to consider this point very serious in national interest. Why is government of India not improving its bad performance? Not clear. Government of India does not respond and shall not respond at all just to protect its own skin. Government of India has actually ignored poor lower class society members from testing. Why is government of India sleeping? No answer in public to sleeping. Unknowingly, very less state of public. Government of India does not look anxious to test all citizens. Testing is too slow. Why should people of Bharat suffer for none of their faults? Only sufferers are poor section of society who cannot afford treatment. Shall we allow such unbecoming state of lack of public COVID-19 testing? Question is that. Why are suffering people not raising their voices? This is another question. Have people become voiceless? People of Bharat are not living as slaves but have become virtual slaves of current Modi's regime. Why has government left its responsibility onto people onto their own? What for funds have been collected from all walks of life? It seems that all people shall not be tested because till now no such policy seems to exist and no addition as such in a non-existing policy of government has been observed. Really speaking, there exists no government of India policy towards public handling of COVID-19 stain plus. Have tested yourself, dear members of society. Poor people, if you intend to test, to be COVID-19 tested, do it by yourself on your own expenses. Because no government of India exists for you, spend 1,200 to 2,400 rupees for testing one time. It's now your duty to conduct your own test. After testing is over and having detected positive, pay for your treatment as well along with medical assistance cost. Remember the medical attendant cost charges 1,500 to 3,000 per day, 1,500 to 3,000 per day. If you isolate in your room, also all expenses of attendant, food, boarding and lodging you have to afford. You have to buy protocol-related medicines, injections, oxygen if required, pay for ventilator as well, and all PPEs necessary for attendant. If you stay in hospital room, rent itself would cost you around 10,000 to 20,000 rupees per day minimum. Therefore, be ready with your many lakhs rupees. People shall have to decide for themselves for there is no one responsible for you from government. COVID-19 virus explosion has to happen, has been happening partly. Come what may due to inefficient sleeping attitude of Government of India and lethargic public, COVID-19 shall certainly explode in Bharat in form of COVID-19 plus variant technical efficient. A nation, a nation where neither public is serious nor government is serious, nothing other than anticipate explosion would happen. A society that remains non-serious and on top of that sleeping shall have to face those offending adverse results for sure, for certain. A nation that cannot think to resolve problems seriously, such results are imminent. A nation cannot wait for many years to have prevention implementation from impact of COVID-19. Out of my understanding, 1.3 billion people, including many crores intellectuals, but lips are stretched tight, they are not speaking even. Speak of all the take necessary action because government is totally lethargic. Note what is happening in UK, etc. People must think of our nation and not government of India. You must look, UK has been again sent to lockdown, on lockdown for 1.5 months. Governments are trying to ignore COVID-19 by diverting issues, but public must act smartly. Think to get a working government and not current sleeping. One chowkidar political guard can also sleep and often sleep. My dear friends, I just narrated my posting, and you can see this graph is only shown falling while actually state of COVID is rising. And what has been done is actually unbecoming. Report is unbecoming, not through report. You can say report is very, very, they say it's under control, but I say there is no control, to be very frank. I can say no control at all, and same comments as can say people asleep, government asleep, people are not serious, government is also people are responsible, government is not responsible. Drastic failure exists, but nobody cares, no interest in testing whole population until population is not tested. And the population test, you cannot say we are in control. There's no policy, no change in policy, both are here, and seriousness doesn't exist, unfortunately. These are just comments, and you can say these are not flopped comments, these are relevant comments. Inefficiency exists everywhere, which we have to be very seriously we have to take into consideration, and we have to see because this is going to affect like this everywhere, and we want answers to all these questions that are here, and this requirement, how can it be fulfilled? I cannot say. This requirement should be fulfilled, and this is very important point here, control schedule. So we can say this is very, very important aspect here of control schedule. How can we move with this? I don't know, and I can say this is also same. So I highlighted this, can't be fixed due to no information, and we should not forget that this point here is also very important from perspective viewpoint. And you can say here this, you can give another color on this, it doesn't make many difference, but just for differentiation we are here and we should know how it is. So it's here. No, this answers who will give us? I want to make a control schedule, who should give me? That's my point of view. And question is the whole population, who is responsible for that? That's another point of view. Who is responsible for the whole population of Bharat testing? This must be known. So who shall answer these points? Without this is actually our solution. This is solution. Handling solution, you can say. How to control, or you can say how to contain. How to contain. Contain, how to contain. Question is contain. Contain is question. I can say question mark on both. Who will do this? Contain this. Who can contain this? That's a question of point. And this should be red one, because this is very serious matter. We cannot say that we will do or will not do, but we have not done anything on that, and that's a very important point here. And we can say we have to be very serious about this. Contain, how to contain. So we may use this also later, and we can say okay, so we have to find solution to this problem, and solution lies somewhere on sheet 1. This is our solution, if you can think of. There are people think of, but unfortunately, They're not thinking अल्फा के वंश कोई सोच नहीं रहा है. 112.35 करोड़ टेस्ट नहीं हुए, करने पड़ेंगे. अगर आपको सिचुएशन संभालनी है तो you have to test these people who are left untested. This figure 1108 is very, very troubling. It should be this much. This pair should be this much. To make it this much, we have to do this much. Got it? अगर हमको ये पॉइंट अचीव करना है 91 डेज का, तो हमें इतने टेस्ट रोज करने होंगे. If we want to complete our testing project in 91 days, we have to test 1 crore 23 lakhs and 11,000 something persons every day, or you can say 1.25 crores. अगर आपको इससे लड़ना है, if you want to fight 1108 days, you require this position. And if you say no, we cannot do this, then you can go to 4 months and you can say, okay, we want 92 lakhs test per day in 120 days, and you want 5 months, you can say, okay, we want 7 lakh 34,000 tests per day, and that is in 152 days. And if 6 months, you can say we want 61 lakhs tests per day, or 62 lakhs tests per day, finish in 183 days. Choice lies on public and government, but I would say best is this period that says you test 1.2 crore or more per day, so that you can finish this 91 days. So 91 days milestone to 183 days milestone can be considered positively, affirmatively, to find a smooth solution, for which you require to additionally resource yourself, and that is 12 times to 6 times. If you want to finish this testing work in 91 days, you have to augment your resources by 12 times, up to 12 times. And if I say 183, we say, which is 6, means it should be in 6 times upgrade of resource, quantification of available resources 6 times more. That's the only way it is. Otherwise, there is no solution at all, and we have to just see this curve and think we are happy. That's no solution, because this figure is very, very critical, 35 crores, and this can increase up to any number of crores, whatever number of crores, and that probability we have seen every day. And that's very important point we have to see, and we can expect this position here also very unbecoming. This is in crores, 11 crores something, or you can say this is a very, very unbecoming situation, and we have to be serious about this matter. You cannot make magics in dream. Reality is a must, and that must be faced very patiently and clearly if you really want to make something for nation. This figure is too low, this is too low, this is too high. We have to be very serious about this matter. It's always easy to say we have contained, we have win over this, but facts are different. In fact, we have not done anything. We are just giving lip service to people, and that is not enough. That is not enough, and we have to be very, very hard-working, smart-working, and we have to find hard-working solutions. Otherwise, we do not have, you can say, patriotic attitude, approach towards people of this country and nation. Giving false information at international level doesn't make you stronger, because when explosion occurs, it shall be noted by whole world. So at that time, it will be realized that you included in your reports irreliable or unreliable, you can say, information, and that information did not help, because you cannot falsify COVID impact. COVID is there, and it shall remain there if you do not understand these points. I don't want to repeat what I repeated in many last videos. You have to be very serious, very serious, very serious. If we are not, again I say, if we are not, we kill ourselves, we kill our people, our public. If you want to kill our public, it's choice of your people. I say, I suggest, again I suggest, take your own care yourself. Do not depend on government, because government is not interested in funding testing or in funding treatment after testing or in taking care of those who have been discharged. Again, three issues that come out of this talk. Issues are: number one, how to do testing project complete. Number two, how to treat those persons or individuals who are declared COVID-19 positive. And number three, how to deal with those who have been discharged but are again prone to strain or variant. These 3 points speak a lot. If we can think for them, it shall be nice. It shall be in national interest, individual interest, population interest, and it shall upgrade, it shall add to value of our international reputation. We can't expect our reputation and our healthy state of nation by just speaking something which is not true. हम झूठ बोल बोल के कितना आगे बढ़ सकते हैं, ये हम जानते हैं कि झूठ कभी नहीं चल सकता सच के सामने, और सच आपके सामने है जो मैंने आपको दिखाया. Truth is there. You can read this, you can view this, you can interpret this, you can understand this. Political less, there's no politics in this. Again I am saying there's no politics in this. This is purely health and safety issue. People must be protected. They have been subject unknowingly or ignorantly or condoningly into COVID-19 hell, you can say, into tunnel of COVID-19, which shall pull them into jeopardy. And that jeopardized state of our country must be protected, because we are very big population, 130 crore population, and out of it 87% or 86% are still under current, under wattage of COVID-19, under attack of COVID-19, because until they know by testing how they reached there to get into COVID, where are they now? Are they positive or they are negative? There are people who say, no, we don't worry about this, we are healthy. Yes, they are healthy, but you are healthy, fine. You are protecting yourself. What about others? That's point here. We have to be very serious. बहुत गंभीरता से सोचना चाहिए, बहुत गंभीरता से. हम अपने को तो बचा रहे हैं, लेकिन क्या हम दूसरों को मार रहे हैं, ये बात आती है सामने. इसीलिए थोड़ा संभल के बात करें. और मैं सरकार को भी कहूँगा, ये फालतू की बातें ना करें कि हमने सब संभाल लिया. आपने अभी कुछ नहीं संभाला है, अभी बहुत कुछ संभालना है. कह कर कि हमने 13-14% टेस्ट करके सब संभाल लिया, कोई समझ नहीं सकता, कैसे कह सकता है. या तो वो स्टडी नहीं कर रहे, या उनको समझ नहीं आ रहा. दे आर नॉट अंडरस्टैंडिंग एनीथिंग. नन इन गवर्नमेंट नोज एनालिसिस, और दे आर जस्ट barred from publishing right information. Either there is. So it is very, very serious matter, I say, very serious matter. We have to understand this, that something wrong is happening around. Risk factor is there. We are not understanding risk. We are not realizing that risk exists, but it exists. You realize or you don't realize. You cannot say risk doesn't exist. Risk है, रिस्क को समझना होगा, रिस्क को संभालना होगा. रिस्क नहीं संभालेंगे तो रिस्क हमको पकड़ के फेंक देगी, मार देगी. जो लोग देखने के बाद भी आंखें बंद कर लेते हैं, सुनने के बाद भी कान बंद कर लेते हैं, उसका तो इलाज नहीं हो सकता। लेकिन रिस्क हमको दिख रहा है, आए या ना आए तैयारी तो करनी चाहिए। मान लीजिए नहीं होता किसी, बड़ी अच्छी बात है, आप सब सही रह जाते, बड़ी अच्छी बात है। लेकिन उल्टा हुआ तो क्या करेंगे? ये बात ही साइंटिफिक है, ये बात ही एनालिटिकल है, इसका एनालिसिस करना बहुत ज़रूरी था और है। इसलिए अब आपके हाथ में है, आप अपने पैर पे कुल्हाड़ी मारना चाहते हैं या पैर को सही रखना चाहते हैं। पब्लिक बहुत है, पब्लिक अभी 112 करोड़ से ऊपर है जो नहीं जानती उनका क्या होगा, और वो जानना भी शायद नहीं चाहेंगे क्योंकि उनको बेचारों को पता भी नहीं होगा। मस्त है सब, रहिए, कोई बात नहीं, मस्त रहिए आप। खैर, अब मैं ज़्यादा नहीं बोलूँगा, 50 मिनट हो गए हैं और मैं ज़्यादा आज बोलना नहीं चाहता, फिर बोलेंगे